Hello, everybody, and a warm welcome to all of you who are joining us from around the world. I'm Kirsten Andreasen from BAO Systems, and I have the pleasure of moderating this spotlight session on using DHIS2 as a national NTD database to extend routine data collected by HMIS. The Neglected Tropical Disease Program in Ethiopia is using DHIS2 to develop a data warehouse that extends routine data collected by the national HMIS through integration with global epidemiological survey support services provided by the World Health Organization and other partners. During this session, we will explore the use case of building a DHIS2 database to aggregate data from multiple external sources and the challenges and opportunities such a system design provides. We will look at a specific example of working with WHO to integrate a recent epidemiological survey. Before we dive into this, I would like to introduce to you our speakers. Diesa is the data manager of ESPEN Collect, a set of mobile data collection services that the Extended Special Project for Elimination of Neglected Tropical Diseases makes available to countries organizing mapping and impact assessment surveys. He has 5 years of experience as a data manager at WHO Regional Office for Africa and 3 years of experience as an enterprise application developer. Amsaya Tafara is the integrated NTD data system and M&E advisor of the NTD program at the Federal Ministry of Health in Ethiopia. In this role, he supports integrated data systems through collaboration with the Policy and Planning and Health Information Technology Directorate, as well as Ministry of Health staff and implementing partners. We are also joined by Adam Preston, a digital health advisor at RTI. Adam supports projects in the global health portfolio to implement technology on the projects. I wish to add that RTI is a bronze sponsor of the DHIS2 Symposium. Following the presentation, we will have time for questions and discussion. I encourage all of you already to use the Q&A feature to ask your questions and leave your comments. And now, without further ado, I turn it over to our speakers.
Okay, thank you. First of all, I would like to thank the organizer to allow us to present the experience of Ethiopian DHIS2 for NTD program. I think we will present our experience. Maybe Adam, please. Next slide, please. Yes, we will present the recent collaboration of NTD program and WHO, which will support us under the SPEN project. The WHO support Ethiopia in terms of preparing treatment data and planning data for providing a drug for NTD program.
I'm sorry, can I just interrupt? There seems to be a problem or a lag with the PowerPoint presentation. I'm wondering if Adam, maybe you want to just stop sharing and try the sharing again?
Yeah.
Okay, sorry about that. Try that.
Okay, that
I
looks
think
better. Yes. Okay, let's try. Yeah, let's go from here and keep an eye on it.
Sorry for the interruption. We will present the recent collaboration of the Neglected Tropical Disease Program at the Ministry of Health Ethiopia and the World Health Organization under the expanded special project for the elimination of NTD focused on the Africa. In this session, we will present the DHIS2 as the national HMIS in Ethiopia, as well as the downstream NTD database, and also some of the experience of WHO on the SPEN Portal and the SPEN Collect. And finally, we will see the integration of DHIS2 with a SPEN Portal. As you know, neglected tropical disease, as the name indicates, the disease is neglected in most countries, which is basically the burden of these highly risk for developing country. So I think maybe neglected tropical disease not an issue for America and Europe, but for Africa, I think still neglected tropical disease an issue. Please, next slide. Yeah.
Sorry about this. Let me try this one more time.
Freezing.
I'm sorry.
Yes, now, shall I continue?
Okay.
Yes, please.
Is this okay?
Yes. Yeah.
Yeah, as mentioned before, we have PCNTDs in Ethiopia. PCNTD means under the implementation of preventive chemotherapy, one of the strategies to eliminate neglected tropical disease. I think in our case, the major PCNTDs are 5. The first one is trachoma program. In our case, I think around 70 million of the population are at risk for the trachoma, and the second one is onchocerciasis. Around 28 millions of the people are at risk for onchocerciasis. Soil transmitted helminthiasis, around 98% of the total population are at risk of soil transmitted helminthiasis. Around 50 millions of population are at risk of schistosomiasis, and around 28 millions of the population are at risk for lymphatic paralysis. So Ethiopia is implementing this PCNTD to eliminate by 2030 based on the WHO roadmaps. Next slide, please. Yeah, these are our most of the NTD framework to eliminate disease. The first thing we need to implement is assess whether the disease is prevalent or not using mapping before the implementation of the intervention. Then most of the NTDs are using, the first one is mass drug administration based on the WHO protocol. The other thing is work on wash, sanitation, and hygiene. The same thing also on vector control for especially in leishmaniasis, lymphatic filariasis, and on coxsackiasis program. And behavioral change is another strategy to eliminate NTD. The other one is morbidity management, like for the LF, hydrocele and lymphedema management. For trachoma, TT surgery is also another strategy to eliminate trachoma and PC NTDs. Based on the WHO recommendation, we will provide mass drug administration for implementing areas. After the implementation of specified round of treatment, the program is expected to conduct impact assessment based on the implementation of the intervention. Then we are expected to follow surveillance survey. So we have different surveys for each disease, and then finally we will prepare dossier which accommodates the disease history starting from the MD or treatment data, wash data, and impact and surveillance data for learning and to share the experience for other countries. Then finally, after the preparation of dossier, WHO give a certification or validation for the elimination of NTD. These are the NTD Elimination Framework. Can you go to the next slide? Yeah. Why it is important to have the data in the national NTD database? I think we have HMIS as a national, which incorporates 9 indicators, but beyond that, we also prepare national NTD database using the DHIS2 because of this reason. The first reason is to optimize program planning, use, and action for the NTD program. The other one is easily accessible by a program team and donor to mobilize resource. The other thing is decreasing fragmented and heterogeneous system utilization. And also decrease unnecessary data extraction from the different platforms. One of the recommendation of WHO is transition of donor-driven to program ownership. So this system can enhance government ownership. The other important thing is this system will help us to prepare for dossier preparation. Next slide, please. Next, I will present the Ethiopian NTD database. Basically, we have 9 indicators incorporated in the national HMIS from 131 nationally specified indicators. These indicators are reportable quarterly and annually based. 5 of them are treatment-related indicator, and 4 of them are case management related indicators. These indicators are integrated through HMIS system. Next slide, please. Yes, actually, we have 2 types of data, routine and event data. When we come to the routine data, it is specified in period, and the event data, which is a point in time. In Ethiopia, the NTD program needs both for the WHO annual reporting forms for treatment reporting and planning purpose. And the routine data includes data from the programmatic activities such as morbidity management, reportable on monthly basis, and the mass drug administration annually and biannual reported from the health facility. Additionally, the NTD program is event data comes from the epidemiological survey. In Ethiopia, the national HMIS information system didn't incorporate the NTD routine data and event data. So it lacks comprehensively capture for the programmatic purpose. So that is why we established the national NTD DHIS2 system. Please, next slide. When we come to our data flow or architecture, we have two types of data. The event data, we are expected to collect using for trachoma survey, tropical data platform, and for cysto STH program, SPEN collects, and for transmission assessment survey for lymphatic paralysis using secure data kits. So we link those event data to our newly established NTD database. The other thing is routine data. The MD and the morbidity management comes through facility, and then through the parallel based and the HMIS based, then finally we synchronize into NTD DHIS2. The other one is MD data. We actually collect MD through Excel based and through the HMIS DHIS2 system. Then finally we integrate this HMIS DHIS2 system into NTD DHIS2 systems. So finally we have one centralized NTD DHIS2 system which captures the event data and routine data. This data will be helpful for the donors and the NTD team to further improve the program implementation and further input for the elimination and the eradication of NTD DHIS2 NTD diseases. I think these are the other one is WASH-related data from the UNICEF integrated to DHIS2 system. I think these are the data set synchronized to NTD DHIS2 system. Then I will give the chance for the DC to present the SPEN Collect and SPEN Portal API. Thank you for listening.
Thank you, Msayo. Next slide, please. I will first talk of a brief about a SPEN and a SPEN Portal. The expanded project for elimination of neglected tropical disease called SPEN was established in May 2016 in the spirit of a public-private partnership between WHO Regional Office for Africa, the member states, and the NTD partners, in the effort to mobilize political, technical, and financial resources to accelerate the elimination of the 5 most prevalent neglected tropical diseases. The mission of SPEN is to accelerate the elimination of the 5 NTDs to protect 100 million people in Africa. And the SPEN Portal is an electronic platform designed to enable health ministries and stakeholders to share and exchange subnational program data in supporting for the NTD control and elimination goals. So in the SPEN portal, you can find the maps for the 5 PC NTD, data, documentation, and resources, all related to the 5 PC NTDs. And all the data for creating this map and data came from the joint application package that contained the GRSM for drug request, the GRF for MDA treatment, the APRF for reporting the epidemiological data, and the TEMP for trachoma data. All these packages are formally submitted by emails or by the chat upload tool that is a feature of SPEN Portal. Next slide, please. And SPEN Collects is a full package that SPEN made to support the epidemiological coverage survey. So it contains the application, and it contains also people that support countering having the surveys. So it was launched in August 2018, and in this slide we have some numbers. From January to June 2021, we had supported 14 countries and 26 surveys. And the number of surveys is still increasing, because we start with 5 surveys in 2018, and in the mid part of 2021 we support 26. And we plan to support over 60 surveys for this year. And we support survey for 5 PC NTD, lymphatic filariasis, onchocerciasis, schistosoма, and STH. Next slide, please. So how to use SPEN Collects? It starts by a request from the national program by SPEN Portal. And after the request, a senior scientist will review the protocol and approve it, or he will request further information. And once the protocol has been approved, SPEN will assist the country in the training, or by providing some material that can miss, like a smartphone. And then after that, SPEN will also assist the country to set up the smartphone and to set up all tools that to follow up with the survey. It will also assist the country to monitor the different mistakes from the survey and to clean the data. And it will, and from the start to the end of the survey, the country will have full access to this data. And at the end of the survey, the SPEN team will have the team to create the APRF files. And once the country approves the APRF, he will officially submit that APRF through JAP upload tool or by official email. Next slide. So in this slide, I will talk about a SPEN Portal and the database. So a SPEN Portal, we use a SPEN Portal with SPEN Collect, because the data that came from SPEN Collect will be aggregated to the APRF file that is the official format to submit the epidemiological data. So this APRF file will be submitted to through JAP upload tool to SPEN Portal. And SPEN Portal has also a API in application package, in application program interface that will allow to integrate to external system. And the request from using SPEN Collect it's also made to SPEN Portal. And we also use Metabase to SPEN Collect survey. It's a data visualization tool, and it also has an API that will allow to integrate to external system like DHIS2. We also use Metabase to allow secure access to data collected to the country. We also use it to monitoring and clean the data. Next slide. So we assist Ethiopia for the HIS2 and STH remapping survey, and the data that we came from the survey will be integrated to DHIS2. The objective of this remapping survey was to support progress toward interrupting the transmission of Schistosoma mansoni, Schistosoma hematobion, and STH by informing treatment planning at the sub-district level. So the collection platform used was SPEN Collect, and will of the package of advantage, like the review of the survey protocol by a disease subject expert. We also assist the team for the creation of the different form that has been used to the survey. We assist also the team on setting the smartphone, and we assist the team to the creation to the dashboard for the data for a secure access. And with the help of RTI, that the data that will come from this survey will be integrated to the national instance of DHIS2 of Ethiopia. Next slide. So I will invite Adam to talk about the integration of DHIS2 with SPEN Portal. Thank you.
Thanks, Desi. We're running a little long here, so I'm going to try to speed up. But I just wanted to talk about how we went about integrating data from the SPEN Portal to our NTD DHIS2 database. So we had a couple different options. As Desi described, the SPEN Portal combined with Metabase provides a few different ways of exporting data. One of them is through an API. And so this was our first option. And we looked at this as first, really. And this is the system-to-system integration, where we would build a data pipeline that would export data from the SPEN Portal and import it into DHIS2. So there's some pros and cons I just wanted to go through here. The pros of doing it this way is it can be fully automated. There wouldn't need to be any manual processes or intervention in exporting the data. It could be scheduled for when data is entered and then automatically imported into the DHIS2 system. If there are existing data pipelines, those could be leveraged here. We didn't have those, but that would be an advantage of using an API. And the other thing is it can operate in real time. So as data is entered and provided in the SPEN Portal, we could automatically synchronize that with the DHIS2 database. The downsides here are it does require more technical support. We needed to make sure that there would be the personnel that could oversee this process and resolve any issues. The other problem is it does require additional tooling when compared to this other option that I will describe next. So the other option is kind of more of a manual process that will import data in bulk. And there are a number of DHIS2 apps out there that provide this. One is the bulk import app, and that was developed by HISP Uganda. And the advantages here is that it is an Excel-based process where there's a data template that includes all the data from the SPEN portal, augmented with some additional information such as the organization units and data element IDs. But there's a data template that could then be used, and it these bulk import apps are available. They're free. There's a couple different options out there, and it requires less technical support. I mean, if you're familiar and comfortable using Excel, it's something that the team can support. The cons here is it is a manual process, and it requires this import to occur like at a certain frequency, and that's just something that would need to be done, and it is manual. The other is it requires a mapping exercise that is for each template, mapping data elements from one system to another, mapping organizational units from one system to another. So we ended up, after looking at these two options, we ended up using this this bulk import app. And let's see, let me get to this. So this is kind of what it looks like. Again, it's a DHIS2 app that provides this user interface for uploading a data template and mapping that data to the data in DHIS2. It supports both event and aggregate data models. And so this is something we evaluated and ended up using here for some of the reasons I described earlier. So there's some challenges that we found in doing this. Redistricting, this is a problem a lot of different programs face, but it's changing districts over time and making sure that we're synchronizing those changes within DHIS2 and tracking those district changes over time as well. And so this is not something unique to an NTD program, but it is something that we have to address, and it has been a challenge. The other is there's no shared identifier for administrative units. When we're pulling data out of SPEN Portal, currently, or at least a few months ago, we didn't have that level of granularity. We only mapped it to the national level, and so there are some challenges in actually doing data analysis when the data is not mapped at the lowest level possible. Data from SPEN, I just kind of talked about that. And then the other thing is data imported to SPEN in the form of a EPIRF report there's a timing problem there. So the data might be available. The data that we're pulling from SPEN Portal is actually coming from this SPEN collect process. And so then there's another stream that's using the JAP upload or the EPIRF upload tool that Desi described. So there's basically two sets of data that can be that exist at the same time. And so this allows for verification, making sure that the data reported through the EPIRF matches what we're seeing through the EPI collect or the SPEN collect. But it also leads to a divergence, and that is something that is just inherent in this process. But it has been a challenge with the integration. So next steps, while we appreciate the convenience of using this data template, probably the most efficient option is a system-to-system integration just using the API. And that's something that we're working towards. Improving the documentation for the NTD manager, just making sure that this process is understood by the NTD team. And next is importing survey data from past years. And so this is something that we're currently working on. We have data from 2014. And so we're in the process of importing more data. Let's see, further develop dashboards according to NTD program needs. We conducted some trainings on these dashboards that we've developed, and so we're looking at improving these dashboards, making them more useful. And finally, just using more parts of DHIS2, making sure that the data that's coming in is clean as possible, and so that just means implementing additional validation rules. So just to sum up, Ethiopia's routine health information system doesn't collect all the programmatic NTD data, which necessitated this NTD database. The NTD database is a data warehouse. It aggregates data from multiple sources. And the SPEN, the WHO SPEN portal supports EPI surveys and provides an API framework for external systems like DHIS2. So we're a little bit over time. I just wanted to acknowledge the Ethiopia MOH and NTD program, WHO, and Sightsavers for being partners in this activity. So we're a little bit over time, so I think we can turn it over to some questions now.
Yes, thank you very much, Tafara, Diese, and Adam for this presentation. And yes, we do have time for some questions and discussion. I noticed already that there was a bit of some questions and discussion going on using the Q&A feature, so I can read those out. There was one question from Derebe Tadase, and he was wondering, do we have SPEN data for regions at the subnational level? And Tafara responded saying, yes, we have it free to access. And then Dave Melkman added that, yes, the portal has lots of subnational data broken down by countries. And then another question from Tadesse, the latest data I see on the SPEN website for Ethiopia is 2019. Isn't that late for a digital system? Any reason for that? So I will turn that over to one of you to answer that.
The data is not all for the system, because we still update, we still putting data on SPEN Portal, because we have a lot of data in SPEN, but before putting those data in SPEN Portal, we have to be sure that the data is clean and readable. And about Ethiopia, I will let Sayo to complete. About Ethiopia, it's a challenge because we have there is many districts, and we have to clean those data because the spelling, we have the spelling issues. But I don't know exactly what is the latest here of the data we have, but we have data after 1997. But before putting those data, Ethiopia must also submit it by the JAP, because the data that in SPEN Portal has data submitted through the joint application package. Thank you.
Okay, to add something, thank you, Daisy. I think, yes, actually, the question is very important. Actually, we are now at 2021 because of the COVID pandemic. I think we submit 2020 treatment data and 2022 planning data for WHO before August. I think the forms are under the review. In our case, we already submitted the 2 reporting form for WHO. I think after the approval, I think it will be shared for the users. That is my understanding.
Thank you. We have another question. Does the bulk data import app allow you to decentralize data import, or is this still centralized at national or provincial levels?
It can be decentralized. It can be at whatever level is in that data template. We import data at the national level. But it can be whatever you include in that data template. Of course, the access that you have that you're logged in with to DHIS2 will determine what you can import. But if you have access to import data at all levels, then you can create a data template that would support that. But there's really no limitation on, at least from the data import app, on what type of data you can import or at what level.
Thank you. Another question, will proposed or current WHO DHIS2 entomology elements and indicators be added later?
Yes, I think for most of the time for the lymphatic paralysis and onchocerciasis program, I think we have historical data of entomological data for onchocerciasis related to vector data. I think in the near future, we will integrate those data into our system. Now we are cleaning the historical data for importing to our NTD DHIS2 system. So we have data in Excel base, but we are cleaning the data to fit for the importing. Yeah, for the future, we will handle all the entomological data to our system. Thank you.
Thank you.
Yeah, just to add on to that really quickly, as indicators are added or as these WHO reporting forms change, those updates need to be made to every step of this process, the data templates, the metadata in our DHIS2 system. And so we see that as just an ongoing activity just to ensure that we're importing all the data that's available into the system.
Thank you. For capacity building, what would you say is the proportion of programmatic content to technical content?
Yes, I think we have been conducting capacity building training for facilitating data use at a lower level. We already conduct the national level training for the programmatic and technical HIT with in collaboration of Health Information Technology Department and Policy and Plan Directorate. So we have also a technical, we need a technical assistance from the Adam and from Ethiopia. So I think in terms of the programmatic, we understood that to improve our genuine data management system, I think the integration of the collaboration of the program team and the technical team is very important. So we understand the involvement of program and technical team. So I think we have enough team technically and the program perspective to handle an NTD program. Yeah.
Thank you. See, we only have a minute left, but there were two more questions in the Q&A, so we'll take those. One of them was, are there plans to start collecting individual level data? And then the second question was from Catherine Zoerhoff. She's thanking you for the session And what advice do you have for any other countries looking to incorporate NTDs into their DHIS2 HIS, but aren't able to include all NTD, their indicators?
I will start by about individual level data. In WHO, we don't need the individual level data. We need site level data, sub-district, and until regional level data. But the country need the individual level data because they have to treat, to follow up some people about the disease. So the data sent to a SPEN portal is not individual. It's site level until regional level. But the country keep the individual level data.
To add something here, I think we have starting to capture ECHS. We already piloted TT Tracker in some region and burden assessment for lymphedema management and lymphedema case from the community. I think in policy plan directorate, we have preparing modules for ECHS for the next year. I think hopefully we will start to capture individual data such as TT Tracker and lymphedema management tracker with the integrated way. I think we will capture the individual data for the next year. We have a plan, yeah.
And I could just touch on the second question, advice for countries that do not have NTD data fully in their HMIS. And, Ethiopia, of course, has a routine health information system based on DHIS2, yet we have developed this system. And the reason for that is just that, the NTD program had needs that were outside of what was provided or provided by the Policy and Planning Directorate of the MOH. So this just allows for more flexibility, and this doesn't mean that this NTD database will always remain in place. At some point in the future, everything might be accommodated by a single routine health information system. But until then, the NTD program can meet its needs for reporting through this database.
Thank you. And just want to say thank you to all our presenters for this insightful and informative presentation.